We interrupt this program to bring you a special report.
Political and social unrest in South Africa was exacerbated during the apartheid era starting in 1948. During apartheid, strict laws and regulations were put in place to reinforce the segregation of different racial groups in South Africa. The four main groups were white, Indian, color, people of mixed descent, black, which were the natives. These racial groups were forced to live separately, develop separately, and grossly unequally. The black majority were limited in their ability to own property and were forced to live on townships in living conditions that were poor, unsafe, and unhealthy. Apartheid cruelly and forcibly separated people and had a fearsome state apparatus to punish those who disagreed. Civil unrest continued as opposition to apartheid grew. The government continued to use violence as a means of detaining the people under pressure. The South African government began meeting the demands of the people, abolishing certain apartheid laws such as the passbook. Soon after, apartheid was completely abolished in 1994 under the new South African Constitution, followed by the inauguration of Nelson Mandela as the first black president. Although it's been over 2 decades since the abolishment of apartheid, the impacts of apartheid continue to manifest in various social and political aspects of everyday life in South Africa. Apartheid has caused there to be drastic implications on health inequity in modern-day South Africa.
The number one cause of death reported by the Centers for Disease Control and Prevention, Global Health, in South Africa in 2016 was tuberculosis, or TB. Symptoms of this disease depend on where the bacteria are growing, but cases are usually pulmonary cases, meaning bacterial growth occurs in the lungs. Symptoms of pulmonary TB include bad, persistent cough, chest pain, and coughing up blood or phlegm. Other symptoms may include weakness or fatigue, weight loss, no appetite, chills, fever, and night sweats. Many people who have been exposed to TB will only have a latent infection, meaning they will have a positive test with no symptoms and cannot spread the bacteria. However, those at greatest risk for TB infection are people who have already been infected with TB bacteria, babies, young children, and the elderly, people who inject illegal drugs, people with weakened immune systems, and especially people infected with HIV, or human immunodeficiency virus. In fact, the CDC notes a large co-infection rate of TB with HIV. In CDC-supported districts of South Africa, 96% of TB patients were tested for HIV in 2017, with 63% being HIV co-infected. To prevent TB infection, avoid contact with people who are known to have TB or who are likely to have TB, such as populations in clinics, hospitals, prisons, or homeless shelters. If you have a latent form of TB, there are medicines that can help treat the infection and prevent the development of TB, and it would also be a lot easier to treat the latent form. In 2017, the CDC estimated the incidence of TB to be 567 cases per 100,000 in South Africa. Treatment options are rigorous, ranging from 2 to 7 weekly medicinal doses over a span of 6 to 9 months, depending on the drug used. However, reinfection and drug-resistant bacteria are likely to occur if treatment plans are not completed. Yet, the CDC did report a TB treatment success rate of 82% in South Africa in 2016.
Diabetes is the second most prevalent condition in South Africa. Diabetes is a chronic condition that affects the body's ability to transform food into energy. The body either does not make enough insulin or cannot use the insulin that it makes properly, and insulin allows blood sugar into the cells to use for energy. Some symptoms associated with diabetes include increased thirst and hunger, frequent urination, weight loss, fatigue, and irritability. Treatment of diabetes requires monitoring blood sugar in the body on a regular basis. People who are diabetic must be conscious of their diet and may even be prescribed insulin to help maintain normal blood sugar levels. Type 1 diabetes develops early in life, so there are no current prevention methods. However, type 2 diabetes can be prevented through lifestyle changes, including diet and exercise. It is estimated that 2.3 million adults have diabetes in South Africa. Some risk factors include being overweight, having a family history, being physically inactive, or being older than 45. And diabetes can lead to a higher risk of other serious health complications.
Heart disease is a term used in reference to several conditions that affect the heart. Heart disease and stroke are South Africa's biggest killers after HIV and AIDS. There are a number of preventative methods. 80% of premature deaths in South Africa from heart disease can be prevented by a healthy diet, regular exercise, and avoiding smoking. 225 South Africans are killed by heart disease every day. Risk factors that can make someone susceptible to heart disease include cholesterol, blood pressure, smoking, diabetes, body weight. The symptoms of a heart attack are anxiety, shortness of breath, feeling lightheaded and dizzy, abdominal pain or vomiting, pain spreading throughout the arms, neck, and jaw, sweating, and the feeling of tightness, pressure, or squeezing pain in the chest. There are a number of treatment options, including medication, devices, surgery, or lifestyle changes.
Throughout the country, 2 major health agencies that focus on disease control and preventions would be the South African Center for Disease Control and the Institute for Healthcare Improvement. Both of these major health agencies spend a lot of time networking for the betterment of disease outbreaks not only in South Africa, but in a variety of other countries.
Kai Brady, a senior biology major, took part in this enriching experience in the summer of 2018. She said, quote, "I gained an appreciation for differences between people and a passion to work collaboratively with groups outside the United States. As a health professional, I will make it a priority to understand how certain ethnicities and races can be impacted differently by certain diseases and how treatment plans can vary in success between different groups of people." She also said, quote, "It is important for pre-health students to visit other countries because as a healthcare professional, you should have an understanding of the healthcare system from a broad viewpoint. In addition to this, cultural barriers can impact patient outcomes, so being aware of differences between people can prepare you to be a more informed and sympathetic physician," end quote. Attending this trip will be beneficial in order to advance as a pre-health student and a global citizen. As a global citizen, it is important that our identity transcends physical borders and creates responsibilities outside those in our immediate community. Extending our borders creates a global community with shared responsibility of every citizen. This is important to understand as we enter healthcare settings and develop our passion for helping others. South Africa holds an abundance of resources, culture, and history that could take years to uncover. Having this experience will just scratch the surface of the true essence held in this magnificent country. One person at a time, the status of global health around the world and in South Africa can be improved. This trip will create bonds that connect everyone, developing a genuine care for the well-being of our brothers and sisters everywhere.